most men diagnosed with prostate cancer in America are diagnosed with a low risk prostate cancer.
Yes, although it's interesting because that phenomenon is changing too. That proportion is changing too. When I started my training in the early 2000s, half of all the prostate cancers we found were low risk because we were doing very pervasive PSA testing and finding all this low risk prostate cancer over the years. First of all, the pathology standards have changed a little bit. So some of what we would have called low grade in the 90s and early 2000s, we now call intermediate grade. But more importantly, we're actually trying very hard not to find the low grade cancers. So the old paradigm was if you had an elevated PSA, you need a biopsy. Today, most men with an elevated PSA, unless the PSA is really high, should have some sort of secondary test first. And that can be a multiparametric MRI, or it can be one of a number of urine and blood tests that we now have on the market to try to identify clinically significant prostate cancer. Now, it's critically important to recognize that all of these tests, MRI and all the blood and urine tests that are out there, all read out their result as the likelihood that if we did a biopsy, we are going to find a grade group 2 or higher prostate cancer. So, positive test, quote unquote, means grade group 2 or higher. Negative test means either no cancer or grade group 1. So we are implicitly telling the patient, whether or not we say this explicitly, we are implicitly saying if there is only a grade group 1 in there, we don't want to find it and we're not going to do a biopsy. So with use of these sorts of tests, we've actually seen the proportion of men with low risk disease fall to now about 20% of all the prostate cancers that we find in the US. So we still find a lot more of them here than in some places like the UK, where you cannot get a biopsy without finding something on MRI. So 20% is still higher than a lot of places, but it's much lower than it was in the era of PSA biopsy.